Burrillville, Rhode Island. All right, I missed some of this, and I'm trying not to be redundant. I've crossed off a lot. Thank you for producing a draft and letting us comment on it. There were some areas where you did a very good job. There were other areas where I felt like it might have been Friday afternoon and you were just trying to get home and meet a deadline. One of those areas, I know, I'm an engineer, I've been there. One of the areas is in the areas of water, and I'd like to read that. While groundwater withdrawals from the MTBE contaminated wells for the processed water are not a health concern at this time, these wells may not be used to provide water to the plant's offices. I feel like you guys had a very huge misstep on that one. I'd like you to go back and look at the health effects from that well, not only from, you know, a potential chemical contamination, but that well has been court-ordered shut. So it's been ordered shut by the court. In opening that, there are many people in this room that were affected by that. That's going to cause mental issues, anxiety, depression, to name a couple of them. So this scope is not just looking at a power plant. This is looking at every piece of that power plant and the health advisory opinion that you need to give on that. And you really need to hone in on the water, and you need to talk about not just the chemical effects of the water, but if the court ever allowed that well to be opened, that the mental effects and other ill effects it could have on those people. Let's see. All right, number 2. Let's see, all right. So I just want to just get this out there and get this in public. We've been told by the governor and many of the people to trust the process. And it's very difficult for us to trust the process when I'm reading through 600 pages of transcripts from last January where Invenergy is testifying to the EFSB that they met with DOH and said that DOH were in support of this plan. So when I hear things like that, I'm thinking, well, how can we trust this process when 6 months ago Invenergy is testifying that the DOH is already in support? So when I read that, I think, okay, they're going to hold this hearing since it's required by statute. And after that, they're just going to do whatever they can to say, well, you know, we really can't conclude everything, which a lot of your report is. So you've erred on the side of caution, and I just caught the tail end of Cindy Lucia's speech, and I have a feeling she said a bunch of what I'm going to say right now. You need to put this forth, this speech, in an abundance of caution. Anything that could be a negative health effect, you need to bring that forth. Am I too fast? I'm sorry. I'm a little fired up right now at 3 o'clock. The last meeting got me a little... All right. Ready? Things okay? All right. Where was I? Talking about trust the process. What was I talking about?
Cindy Lucia.
Oh, Cindy Lucia. All right, so when you look at these things, I'm looking through your advisory opinion, and a lot of things I'm saying really bugs me. Inconclusive, not enough research. Well, there can be links to health effects. You know, a study may not prove there's a negative health effect, but there could be links to health effects. And not to mention, my mother testified earlier, you know, there are many chemicals that will be emitted from this power plant that are the same chemicals that come out of cigarettes. Okay, well, if those chemicals cause cancer in cigarettes, I'd like to see this report talk about that. Some of those components have been known to cause cancer, and touch upon that a little bit, because I noticed that the word cancer wasn't mentioned once in your report under air quality. There was another area that you mentioned in which, you know, was okay, but you really need to strengthen up the language, like Mrs. Sherman said, and you really need to expand the scope and really expand upon these areas, and you really need to be forthcoming and really tell people the negative health effects that we all know, whether or not they're linked or whether or not studies show, and I believe there's been a lot of great testimony here from our medical professionals that will show that. But I want to make sure that we see that in your final draft. Thank you very much.